Good afternoon, everyone. I'm Daphne Thomas, Executive Director of Communications Marketing and Community Relations. We've got Dr. Randolph on the phone, and he's going to discuss the latest information about the pandemic, the new health directive that the Shelby County Health Department has issued this week. He will also talk to us about safety measures that we can take to protect ourselves and our loved ones, especially during this holiday season. This is being presented by PASO, and they were very generous in allowing everyone and opening this session up to the entire college so we can all partake of the important information that Dr. Randolph has to share with us. Now, I will go ahead and ask Shayla to come to the stage to deliver her remarks. Shayla Cohen.
So to all that are present, welcome to a community chat with PASO. This is done in partnership with Marketing and Communications. Under the leadership of PASO President Katrina Modrow, PASO's efforts are centered in appreciation, advocacy, and action. So allow me to tell you first, we appreciate you making time for us today. The hope is that this presentation will help us all to become more comfortable as public health advocates and empower us to take action where we can with the resources that we have. Critical to our efforts is understanding current information related to the pandemic and the resources that are available to us. Dr. Bruce Randolph, Health Officer for Shelby County Health Department and member of Shelby County's Joint COVID-19 Task Force, is with us today. Dr. Randolph will discuss, as Daphne mentioned, holiday preparedness and our primary defenses against the spread of COVID-19. Also, as a gentle reminder, participant engagement is encouraged. We know that the better informed you are, the more likely you are to spread the information needed in order to counter the impact of COVID-19 on this community, a community that I love dearly. So again, please put any of your questions in the question answer box located on your Microsoft Teams toolbar. I think that's all I'm supposed to say. If you're wondering the reason why this information is being presented, is that I'm a senator with PASO and I am responsible for communications, marketing, institutional affairs, and government relations. The subcommittee that I have the privilege of serving on deals with professional development and sort of member engagement. So with that being said, I thank you for your time and your patience.
Good afternoon to everybody. Now, I want to just spend a little time talking about the coronavirus and the COVID-19 pandemic that we're currently experiencing. I'm going over a little data to just give you an idea of where we are and talk a little bit about our health directive that we issued today, and then open it up for specific questions you may have. So as you may know, and one of the things that you can do if you want to follow the data, you got your phone with you, you can go to Shelby.community and click on the COVID-19 data dashboard and pull up the data that I'm going to discuss with me. Pandemic started in March, around March 8th, 2020, when we had our first case. Now we have 62,334 cases that we've had. Currently, we have about 6,929 active cases. It was reported to us today that we have 905 new cases. So when we look at these numbers here, and we look at our number of deaths, what it amounts to is that about 1.3% of the people who have gotten infected with this virus died. So death rate, we've at 821 deaths out of 62,324 cases. I mean, 1.3% of the people died. currently we got 11% of the people who had been infected are still actively infected. And we look at when we see what percent of the tests that we run, roughly 9% of those tests are positive for COVID. So it's present. One way of looking at it is that almost 1 out of 10 persons are infected with this virus that we're detecting. Everybody hasn't been tested yet, so it could well be higher. The concern that we have is that if you look on our graph of cumulative cases, the number of new cases just escalate. Again, it was reported that we had 905 new cases just recently. But the thing I really want to highlight, since you all are young people, and is to look at the demographics of this virus. And so if you scroll down, if you happen to be following me, you can look and see that the case demographic data reveals that the majority of the cases, about 20% of the cases that we have in Shelby County occur among 25 to 34-year-olds. And then another 13% occur among 18 to 24. So we look at 18 to 34-year-olds account for about 33% of the cases, which means that younger people are getting infected. But then when we look at the deaths, we'll find that it's the older people who are dying. So if we scroll on down and look at the age demographics, we'll see that 90% of the deaths occur between people age 55 and older, 55 and beyond. Only something like 4% of the deaths occur among younger people. So that's the problem. Is your generation, your younger people, you get infected, but you don't have the symptoms or the complications. So you don't think it's a big deal in some instances, but you can bring the virus back to home where mama and daddy and grandmama and granddaddy lives, and they can get infected, and they're the ones who are likely to die if they get infected versus you. So when we look also at this virus as it relates to race, who's been infected by it from a race demographics, we find that 60% of let's back up in terms of looking at first the cases. We find that the majority of the cases, something like 57% of the cases, occur among Black Americans, African Americans. So of those 62,000 cases, 25,000 of them have occurred among Blacks. Black people in Shelby County make up about 53% of the population, but about 57% of the cases. The white population in Shelby County accounts for 27% of the cases, about 12,000. So twice as many cases are occurred among Black people in Shelby County compared to whites. Then when we look at deaths, we find that 60% of the deaths that occurred among Black people compared to 32% among white. Again, Blacks make up 53% of the population, but accounts for 60% of the deaths. So we stated that there have been 800 and some deaths, 457 of those occurred among Blacks. The other thing I want to point out, and we'll move on, is that when we look at deaths and we look at what are some of the underlying problems that have contributed to death, in other words, that put you at greater risk of dying if you get infected, and that's cardiovascular disease, diabetes, respiratory conditions, and obesity are the major risk factors if you happen to get infected with this virus and increase your risk of dying. So that's where we are in terms of data. So we know that this virus is transmitted through body contact, close contact, respiratory droplets, airborne transmission. So our efforts to try to prevent the spread of this virus, keep people from getting infected and subsequently becoming ill and die, is to try to do some preventive measures such as maintaining distance, trying to stay at least 6 feet away. Studies have shown that the virus can be transmitted as far as 15 to 18 feet if someone is singing, yelling, coughing. But if they wear a mask, it prevents that from traveling that far. And if you have a mask on and you're 6 feet away, that's one way of protecting yourself from becoming exposed to the virus and transmitting the virus. Because we also learn, especially among some of the younger people, that as much as 40% could be infected but not have symptoms. And some of the symptoms associated with this virus that you may have heard: fever, headache, some respiratory type symptoms, shortness of breath, runny nose, muscle ache. Very common one is a sudden loss of sense of smell and taste. And so this, but again, 40% of the people may not even have this type of symptoms. That is why, if you listen to us, a lot of times in our campaign, we're urging people, go get tested. When in doubt, go check it out. Get tested. If you have any symptoms, fever, headache, muscle ache, if you know you've been around someone who's been infected with COVID, if you've engaged in some activities, hanging out at the club, partying, and what have you, you've been in a crowded situation, not wearing a mask, you should get tested to make sure that you're not infected. A recent report from the White House task force stated that if you're under 40 years of age and you've been out in a gathering where people were not wearing a mask, you should assume you are infected and you should go get tested and try to isolate yourself from other folk, especially those who are vulnerable. And so what we try to do with our health directive is come up ways that we can have the individual protect themselves, and then also how businesses and services can protect the population. So as an individual, you want to do things such as wear a cloth face covering or mask. You want to maintain 6 feet or more separation from people not of your same household. You want to stay home if you're sick. You want to limit close contacts, avoid crowds and gatherings, especially in enclosed spaces. So one of the reasons why our numbers are really going up out of the roof now is because of Thanksgiving. People got together, had a good time, celebrated, and also now we're due to the weather, people are inside enclosed places where the ventilation is not as good as being out in nature, outside, and therefore the virus is spreading more. Now, one of the things I want to say too is individuals too. If you happen to get tested, you stay home until you know your results. If your results come back positive, then you need to be in isolation. If your results, and you have to be in isolation for a period of 10 days. If you've been exposed, you've been around someone who tested positive, you've been considered a close contact, which is being within 6 feet for 15 minutes or more among someone who has tested positive for COVID-19 is considered positive, and you should be quarantined. And when you're in quarantine, you should be in quarantine for 14 days with the recent alternative options that the CDC has allowed is that after 10 days of quarantine, you could be released if you're not having symptoms of fever. And after 7 days, you could be released if you have a test that's negative and you don't have symptoms of fever. So other things such as, of course, hand sanitizers, cleaning, and this type of thing. I would encourage you to get a copy of the health directive and the stay home, safer at home health order. You can get it by simply going to the website, Chevy.community, and review the individual measures. And then as businesses, we require them to do some things. One is that there's certain businesses we have asked to close for the next 4 weeks. Such type of businesses like museums and zoos, tourist attractions, arcades, escape rooms, theaters, movies, hookah and cigar bars, trampoline parks, putt-putt golf, entertainment and event centers, adult entertainment businesses, party bags, convention centers, concert halls, bowling alleys, and pool halls. We're asking that these businesses close for 4 weeks. We were asking that businesses allow their employees to remain at home and to work from home if all possible. We're asking people to shelter at home, stay home, enjoy your family, trying to keep people from gathering and from crowding, and therefore prevent the spread of this virus. Some other things in this recent health directive that we issued today is that we'll require everyone to wear a mask. Even when you go in the restaurant, you wear a mask until you sit down at the table and your food is brought. Then you take it off and eat. Once you have finished eating or drinking, you put your mask back on while you sit there talking and socializing. Even when you go to the gym, we're requiring that you wear a mask while you're working out in your gym. In terms of number of people we're allowing in restaurants, first we want to say that we don't think eating indoors on site at a restaurant is a good thing to do. You're better off to get it to go, curbside, drive through, eat outside. But if you insist on being inside, then you need to do those things by wearing the mask. Make sure you're 6 feet separated. And the restaurants can only allow up 25% of its capacity. Retail stores and gyms, 50% of their capacity in terms of crowd size. The only other thing I want to add, that we can open up for some specific questions, is that we shall receive the vaccine hopefully tomorrow. Some of the hospitals have received the Pfizer vaccine earlier this week and last week, and have started vaccinating their employees and staff. The health department, we will start receiving the Moderna vaccine. We're supposed to have gotten it today. Hopefully by tomorrow we will start offering it to first responders come Monday the 28th. The vaccine, we are hoping is going to be effective and will help, but it will be a while before we reap those benefits. The general public probably won't start receiving vaccinations until late April, early May, on up into midsummer. We need to get about 70% of the population, so you can multiply 70% of the 930,000 people here in Shelby County to get an idea of how many people need to be vaccinated in order for us to have somewhat of a herd immunity. So I say that to say, just because we have the vaccine available and we start giving it, we still going to have to do the preventive measures of wearing the mask, maintaining social distancing, not hanging out in crowds, and doing the other things to stay safe. I think I've said a lot. Just stop here and just open it up, and we can just have a further discussion and answer any specific questions you may have.
Thank you so much, Dr. Randolph. We do have several questions, and I would just kind of group them. One group of questions, and you just answered about the timeline for the distribution of the vaccine, which is great. Some people had some questions also about testing, about the efficacy of testing, whether the rapid tests with some of the news reports regarding false negative, false positives, and so forth. When it comes to testing, what should people do? Which tests should they lean toward, and how can they get tested?
Okay, so there are three basic types of tests. There's the gold standard, so to speak, of the diagnostic test is really the PCR, but they're actually measuring and detecting the viral genetic material. That is the most accurate. That's what we use to consider a positive test when they're in doubt. The second type of test is the antigen, where they're actually measuring their reaction to the protein of the virus. That particular test, if you have symptoms, you've been around someone, and there's a good chance that you're infected, and if it's positive, you probably are. But you can get some false positives and some false negatives. That's why often if we do that test and it comes back negative, but we really think that this person really may have it, we will get a confirmation CPR test. Likewise, if the test comes back positive, but hey, this is a healthy person, no symptoms, no history of exposure, hadn't been around anybody with COVID, but the test is positive. If we want to make sure we're dealing with a positive test, we may follow it up with the PCR. The antigen test is good when you want to screen a lot of people who have not been around a lot of people, but you want to just know quickly whether this person may or may not be infected. You can do the antigen test. Now, the antibody test, which is the third one, that test simply really detects whether you got antibodies that indicate that either you are currently infected or you have been infected. So that test really is not good for diagnostic purposes. But if a person wanted to know what, I had some symptoms, my test that I took was negative, but I believe I think I got infected by it, and you just want to see if you got some antibodies from it, you would do the antibody test, but that would not be used to make a diagnosis or anything like that. So the preferred test would be the PCR. Now, the testing technique has improved where they don't have to go way up into your nose like they used to. It used to, you have to go get a nasopharyngeal sample, which was very uncomfortable. A lot of people didn't like that. Now you can do it sort of midway your nose, mid-turbinate, and it's not near as painful or discomforting. And so more people are willing to get it. There's other tests. Now there's even a test that has been approved by FDA that you can do at home yourself and get the results. So if you kind of wanted to know, hey, you know what, I'm infected, you can do that particular test and it'll give you a result. But it wouldn't necessarily, if you did that, I would still probably get it followed up with the PCR, or certainly follow up with your primary care doc, the health department for further evaluations. So hopefully it was part of the question, where can you get tested? We have multiple test sites. Go to that same website, Shelby.community, and there is a list of all the test sites that you can go and just call around and see which ones you can get the tests. There's a lot of availability. Currently, we only have about 60% of our capacity being used for testing. So get tested.
Is there a cost, Dr. Randolph?
The cost can vary. There's some free testing that's offered. And so when you call around, you can sort of see which ones. I know the health department, we offer free testing there in Milton, our clinic in Milton, and the one in Collierville. And there's some of the other like community health centers that may offer free testing. The city of Memphis for the past couple of weekends, and I think up until the end of this year, is offering free testing. And so if you even go on the COVID-19 website, Memphis COVID-19 website, they should have a list of all the sites and should be able to tell you which ones are free or not. You pay out of the pocket, COVID tests could run you close to $100 or more.
There are many people who are getting ready for the holiday, and we had a very interesting question from someone about how to talk to family members to let them know that it's not a good idea to gather during the holiday season due to the pandemic. Do you have any advice about how families can cope with the disappointment and how to communicate different strategies for celebrating safely?
I would, the way to approach that is first look at your family, right? So you know you got grandmother there who has hypertension, diabetes, and therefore at great risk, and she's 75. You got granddaddy who's just gotten over some prostate cancer and still being treated, and he's 80. Those individuals, though they may be fairly healthy and what have you, are at great risk if they happen to get infected. And so you would want to protect your loved ones and say, hey, I love you. I just don't want to expose you to this virus. And so let's be safe. I wear a mask, you wear a mask. We may just drive by and say, hey, hi, and keep rolling. If you happen to be in the same household, let's at least try to maintain some distance and let's wear a mask, especially again the young folk. Now, if you know you're going to be, so you're coming in from college, you've been off from college, you know what young college folk do, you hang, you party, you do things. And there's that risk that you may have been exposed, but you're not having some symptoms. You should go get tested. And, if you're negative, then you still should wear your mask and practice your distance, because the negative test only tells you that you're negative at the moment that they test you. The incubation period for this virus is 2 to 14 days. So you can get infected one day, go get tested 2 or 3 days, it's negative because it's too early to detect it. And 7-10 days down the road, you're infected. So it's because when you, especially if you've been around someone that you're having some symptoms, you get tested, you need to still maintain social distancing and really quarantine till you know the results. And still, after that, still wear your mask and practice social distancing. So I would encourage the families to just, let's do as much things as we can outside if the weather permits. If we're inside, let's just really try to maintain the 6 feet separation. Maybe open some windows, wear the mask, mainly to protect the loved ones. And that would be the older generation. You want to protect them so you can celebrate next Christmas and Thanksgiving with them and not have to go to a funeral.
Thank you for that. We have a lot of questions about vaccination. You mentioned earlier that the first responders are already being staged to receive their vaccines, and that later on, the general public like us would receive the vaccine. So this question is twofold. First, once it does get to the general public, they mentioned teachers and so forth. Would college professors be in that group, or what kind of plan, how do you all plan to roll out or prioritize who gets the vaccine and when, and will it be required? Will it ever be mandatory?
Okay. Well, so currently the plan is, coming up with a priority scheme whereby people are placed in phases. So phase 1A are your hospital workers who taking care of COVID-19 infected people, nurses, other doctors, all hospital personnel who are taking care of people who's in ICU and who's sick, and they come in contact with COVID every day. The next group of people are your first responders, firefighters, EMS, and your police officers, because they're subject to come in contact with people. The other group, though, that's in there, that 1A, is nursing home staff and nursing home residents. Because when we look at where most of the deaths in Shelby County has occurred, it's been among residents of nursing homes. And when we look at who have gotten infected, we've had numerous outbreaks here in Shelby County of nursing home staff and residents who've been infected with the virus. So they're in that first group too to receive the vaccine. And then there's other healthcare workers, people who are going into homes, home health care workers, people who are working in other facilities like the intellectual and developmental disabled. And then we go to other outpatient type healthcare settings, doctors and nurses, counselors. Then eventually we get also to people who are in what we call congregate settings. people who are in jail, homeless shelters, in other areas. Teachers also, because they're exposed to kids, a lot of kids who could be infected. And actually, when we look at the fact that 30% of our cases occur among young people 18 to 34, I would say if college professors and teachers were doing in-person classes, they would be at risk, but a lot of them are doing virtual. So that risk is not as great as if you're doing in person, but they would then be eligible. They're falling probably phase 3, phase 4, and then the general population. Another criteria is looking at age. So people who are 65 and older. So if you're 65 and older and you have some comorbidities like diabetes, heart disease, obesity, then you would be at increased risk and would move up. Then is to get to the point where we have this criteria, but also if we got some vaccines sitting in the refrigerator and people haven't stepped up to receive it, it's going to be whosoever will, let them come and we'll give it to you. Because we don't want any vaccine to go to waste. Absolutely. Sitting there on the shelf waiting on people to come receive it when there's someone else, though they're in a different phase, are willing to take it. Because we have to administer this vaccine with the Moderna, we have to administer it within 30 days. And with the one with the Pfizer, it has to be administered within 14 days at most. So, because there's a shortage, we can't afford to let any of it go bad and waste when we got people willing to take it.
In the news in the last couple of days, there's been information about a new strain of COVID over in London. Can you tell us what you guys are thinking the risk may be for Shelby County, for that strain to reach Shelby County, or is it here? And how will it affect your plans going forward?
Well, we certainly have this virus on our radar, and it's a concern. Currently, the current report from the CDC is that there has not been any detection of that virus here in the U.S. yet, but it's a matter of time. Dr. Fauci even said that he probably wouldn't be surprised if it's already here. We just hadn't detected it because we hadn't been looking for it. Same thing, we found that the coronavirus was here before we really acknowledged it was here because, again, weren't really looking for it. So it's there in the UK. We haven't stopped flights from the UK coming to the United States. Now we screening people, so it's just a matter of when, not if, that the virus will get here. Now, what does that mean? Well, we don't know yet. Now, the makers of the Moderna vaccine feels that the vaccine will be effective against this particular strain, but we don't know. What we do know from so far is that it appears that it is more contagious and infectious than what we're currently dealing with. Viruses, bacterial, and microorganisms mutate all the time and change, and that's it's nature. What happens? It's one of the reasons why we're not able to cure the cold or the flu, because the virus changes, mutates. So it's one of those things that we're just hoping that it doesn't take a hold and give us a double whammy. Therefore, the importance of wearing your mask, practicing these safety measures such as social distancing, avoiding crowds, all these type things that we have recommended is becoming even more important that we adhere to them, even though we're getting the vaccine aboard also.
Thank you so much. We also had a question about the availability of PPE. If there are people, you mentioned that this new strain is possibly much more infectious, and so using PPE is more important than ever. Where can people who need masks and so forth get free PPE?
Still check with our health departments. The governor provided thousands of masks that we distributed to the public to address the issue of PPE shortage. Also, people have also become entrepreneurial and creative and are making their own cotton mask, which helps with source control. I mean, it helps if you happen to be infected, it helps keep you from spreading the virus, the respiratory droplets, out to others. Now, those cotton multi-layer masks may provide some protection against you inhaling it, but it's not like if you were wearing an N95. That's the one that they use in the hospitals. And if you're going to really be working around someone with COVID, it'll protect. It blocks 95% of the microorganisms and particles and things. That's the one that we sort of reserve for people who are really, we know, exposed to the virus. Using the cloth face covering and mask is effective, and really that is what will allow you to do more things. I mean, when we look at other countries, China and Korea and what have you, their numbers are much lower than ours. And a lot of that is because they all wear masks and have been wearing them, even when we thought that it was not necessary to do so.
We had someone to ask about our ICU bed capacity. What is the state of our capacity in our hospitals? And what is the plan if we dwindle down to critical levels?
So that's a major concern. That's why we're trying to do efforts to at least blunt, control the rise in the cases. Currently, the capacity is is reported at 93% in some instances in terms of bed capacity in ICU, but in reality, it is probably worse than that, because the issue is you may have the bed available, but you may not have the nurse and staff to provide the care to cover that bed. And so one of the things that we're experiencing here now is there's been an increase in the length of time people are having to stay in the ambulance before they can be taken into the ER. And there's increase in length of time of people being in the ER before they can be taken up to a room, because there's either a shortage of the room availability or a shortage of the staff to provide the services. And shortage of staff to provide the services appear to be a greater problem. Now, the plan is if we get to the point where the hospitals are just overrun front. We have an alternative healthcare system, a hospital that we have equipped, but the state have equipped. There, the old commercial building right on Union has been converted into a hospital, and that will become a place where we would use as an overflow to provide beds and space for patients if the hospitals can no longer care for them.
Thank you. We had a person to ask about batch testing. I guess if an organization wants to do mass testing, how does that work, and is that effective?
So batch testing, or pool testing as they call it, is a technique where you can test a whole bunch of people at a cheaper price. So let's say there's 20 of us, and we want to know among the 20 of us, do any of us have the virus? Are we infected? Now, if each one of us went individually and got tested, we all would have to come out of our pocket $100, right? But if you do this batch testing, you could test all 20 of the people for $10, $15 a piece. Because what they do is they collect a specimen from each person and put it in the same medium, and then they run the test on it. Now, if that result is negative, that meant nobody in that group was infected. So everybody was negative. Now, if it comes back positive, that means at least one person in that group of 20 is positive. You don't know who, so therefore now you got to test each individual to find out who's the person who tested positive. So then you have to do further testing. That technique works if the percentage of people in a population, the percent of people is low. If what we call the positivity rate is low, if it's less than 5%, that technique would work, because your chances of you getting a false positive or something like that is down. Yeah. But currently our rate here is around 12%, 13%, a little too high, because the chances are you're going to get a positive result. Mm-hmm. Now you got to test everybody, and your costs have increased. You get to the point where you would have been better off just testing everybody individually.
Yes. Now, regarding your recent health directives that were announced this week, how do those directives relate to colleges and universities? What are the recommendations from the health department regarding college operations? I have several questions about that.
Yeah. So, according to the governor's executive orders going back to, I think, 38 of 50, colleges, schools, and universities have the authority. Their governing body is the ones who have the authority to decide when to open or not open, whether they're going to have sports or not, whether they're going to and what other measures, whether they're going to have in-person classes or virtual. That's a decision that the governing bodies of the institutions have. We provide advice, we provide technical assistance and guidance, and certainly encourage them to adhere to the safety measures that's in the CDC. Now, where we would get involved is if there was an outbreak. So we found out that, you got 20 students on your campus now infected. then we will get involved because we still retain the authority to do disease investigation and placing people in quarantine and isolation if needed.
Thank you, Dr. Randolph. Final question, and then we can allow you to make any final remarks you would like to make. Someone asked about the Moderna vaccine versus the Pfizer vaccine. Is there a difference in efficacy, or are they basically both just as effective, just prepared differently?
The efficacy is about the same. I think Pfizer came out first saying that their efficacy was 90-95%, and Moderna came out and said when you get the first shot it's about 70. After the second shot, it increases up to about 94.5%. So the efficacy is about the same. The Pfizer vaccine, though, requires that it be maintained at super cold temperatures, something like -70 degrees. And that is, so therefore only certain facilities can really receive this vaccine and maintain it. That's why it was decided to send that vaccine to your large hospital systems, because they would have the super cold freezers that they could maintain the vaccine and not necessarily have to do a lot of transporting to get it to their staff. The health departments and others will receive the Moderna because the Moderna doesn't require as cold of a temperature. Matter of fact, the Moderna can be kept in the refrigerator for 30 days, whereas the Pfizer, once thawed, can only be kept about 5 days in the refrigerator. So the advantage of Moderna is that you can, it's easier to maintain. You can get it out to places to be administered much easier than the Pfizer, and that's why the health departments and a lot of the other clinics will be receiving the Moderna. I think Moderna is also a little cheaper too, if I remember right.
Well, thank you so much for that information, Dr. Randolph. Thank you for your time this afternoon. Do you have any other comments you would like to make, or recommendations or suggestions?
I will just say, if you have any questions, I provided a lot of documents to Shayla that you can ask her about. I told her she freely give it to whoever is interested. Any work you want a copy of the health directive, copy of the governor's executive order, even the other information on how to stay safe. I encourage you to read it, go to the website. But more importantly, young people, really the state of affair of our county, state, and country rests with you. You know, though you may not necessarily have the symptoms and the effect, you can be a major contributor to the illness of other folk. So I just encourage you and ask you to really do your part. And, you can have fun, enjoy your life, but do it in a safe way. Wear the mask, maintain social distancing. Don't gather in crowds. And, I have often said, just because it's open doesn't mean you need to go. And just because it's legally permissible doesn't mean it is medically advisable. So use your wisdom, use your common sense, and avoid situations that could put you or others in danger of the health.
Thank you, Dr. Randolph. I did want to ask you just this one other thing. How will the Shelby County Health Department enforce these new regulations or recommendations or directives, you guys? So you're telling the young people to comply And so are there any consequences besides possibly getting sick and sickening folks in their family? Are there any other consequences they may need to know about?
Not so much for the individual, right? So we're not going to penalize cite someone who's walking down the street without a mask. But we will hold businesses accountable. So we have inspection teams that go out on the weekends, and they may show up at 10 o'clock when the club's supposed to close. And if they find the club still open and people not socially distanced and not wearing masks, then we close it down.
Gotcha.
And we're going to start issuing fines, $50 fine for each violation. So we walk in and you got 100 people without masks, that's 50 times 100. So I think that'll get folk attention.
I think you're right. I think you're right. Thank you so much, Dr. Randolph, for your remarks today and for your patience and your time this afternoon. We truly appreciate it, and we would love to have you back again for updates as the pandemic and the vaccination rollout progresses.
Well, anytime, you got my contact information,
Yes,
so just feel free to reach out and touch base with me.
We will do that. And to everyone who joined us today and were so patient with our technical difficulties and staying with us for this interview, thank you so much. We will distribute the information that Dr. Randolph shared with us. It will be on our COVID website, so you can freely and easily access that. And we will try to process this video as soon as we can and get it uploaded on YouTube. But we will be able to have those materials to you very shortly. Thank you so much for being with us, and have a wonderful evening.